Good morning, everybody. My name is Paul Golding. I'm the president of the Santa Fe Boys Educational Foundation. So now let me introduce Professor Raine, who is noted for his research on the neurobiological and biosocial causes of antisocial and violent behavior in children and adults. He received his doctorate in psychology from York University. He spent 4 years in 2 high-security prisons in England working as a prison psychologist. In 1986, he headed the Mauritius Child Health Project, an ambitious longitudinal study of child mental health following a large group of people from that very beautiful island off the southeast coast of Africa. He is currently the Richard Perry University Professor of Criminology and Psychiatry at the University of Pennsylvania. His main research interest is in neurocriminology, a new subdiscipline of criminology which applies neuroscience techniques to probe the causes and cures for crime. Dr. Raine, who is one of the main proponents of this approach, has won many honors for his research and is the author of a wonderful and quite readable book, Anatomy of Violence, The Biological Roots of Crime.
Well, good morning, everyone. Thank you very much, Paul, for an excellent introduction to this. I think you were spot on, and thank you very much for inviting me to this meeting. I'm really looking forward, especially to the later talks that are going to come in the next 3 days here. I'm just a warm-up act for the bigger acts to come. I'm just going to here to really break the ice on things. And as you see, I'll be talking about a neurodevelopmental perspective on male violence. And just to give you an idea of what I'll be covering today in the next 45 minutes, I'll talk about this neurodevelopmental perspective. I'll talk about early influences on development, of course. I'll move into looking at neural mechanisms which may underlie violence and generic antisocial behavior. I'll then look at quickly a neuromoral perspective on violence and crime. I'll turn to that difficult issue on prevention strategies. What can we do to change this trajectory to violence and antisocial behavior? And lastly, Paul has asked us to really also talk about why is it that males are just more chronically violent than females? We may not, as speakers, always have data to present on that, but Paul has asked us to at least try and speculate on that issue. So that's how I'll end up. I have to tell you that when I wrote the abstract for this meeting, I was halfway through my second bottle of whiskey. And looking back on it, I have no idea what I was doing and how I put all these things. I put in everything except the kitchen sink into this talk. So I'll try and whiz through it as quickly as I can. And I hope I don't lose you all in that process. Now, the neurodevelopmental perspective. I have to say that this perspective is rather speculative. So first of all, what do we mean by neurodevelopmental? So I wrote about this in the context of antisocial personality, which is not violence. So bear that in mind. But if you look at antisocial personality disorder, I think there's reasonably good evidence to suspect that this personality disorder is neurodevelopmental in origin. And I'm giving it as a model for you to begin to think of chronic violence as neurodevelopmental. Think of just maybe the less than 1% of the population who are chronically violent. Would they fit this bill, neurodevelopmental? What is neurodevelopmental? First of all, it starts before grade school. Okay, so it's got early origins. Secondly, there are abnormalities in brain structure and function. We'll talk about that later. It's accompanied by neurocognitive impairments. There are neurocog impairments, and I think that's pretty solid. I think with respect to violence, that chronic violence will fit this bill. Significant genetic basis, I won't talk about that, but I do believe that violence does have a significant genetic basis. A neurodevelopmental disorder has to run relatively stably throughout development. And it doesn't go into remission in the same way that, for example, schizophrenia would. I mean, think to yourselves in your practice, do you see people like this at the get-go, early on in life, showing an aggressive, disinhibited temperament early on? And then it continues into adulthood, and there's a lot of social and academic and occupational dysfunction. For sure that's true of chronic violent offenders, I believe at least. And then in addition, there are associated features to neurodevelopmental disorders. Usually, neurodevelopmental disorders are usually male. If you think of other neurodevelopmental disorders, they tend to be male. They tend to have a low base rate, and there's usually comorbidity with other neurodevelopmental disorders. Other disorders, think of ADHD. Think of specific learning disabilities, which are also neurodevelopmental. And I think you might agree that, the chronic adult violent offenders that you see probably had those origins earlier on in life. So I sort of think that significant violence, chronic violence probably fits the bill of neurodevelopmental. In what I'm about to talk about, I'm not going to go through all of these issues. I just want you to think of this as a working hypothesis. And is it the case, based on everything you hear in the next 3 days, that maybe that small group in the population of chronically violent offenders, they may fit this bill? Okay? So that's just one thing I want you to think about. I'd love the other speakers also to think about from their data, to what extent do you think, or do you not think, that chronic violence in males would fit this type of bill? Okay, as I say, I'll have to skate through here. So now what I want to do is focus, of course, on early influences. And I have to admit, I'm not just talking about chronic violence here. I'm going to talk about psychopathy, conduct disorder, callous and emotional traits. So what I've got to talk about is pretty broad. Okay, so one of the early issues, one of the early factors that is associated with antisocial behavior are what are called minor physical anomalies. These are anomalies that develop during the 3rd to 4th month of gestation. Things like low-seated ears, furrowed tongue, single palmar crease, for example. Single palmar crease would be a minor physical anomaly. And they reflect maldevelopment to the fetus, again, around the 3rd or 4th month of gestation. Obviously, it's an indirect marker for fetal neural maldevelopment. But the key point here is that a number of studies, starting with the paper in Science by Waldrop, all the way back in 1978, Waldrop found that kids with minor physical anomalies are more aggressive, more antisocial than kids who do not have minor physical anomalies, suggesting, in part, a neurodevelopmental basis to antisocial behavior. And that's been followed up by quite a number of other researchers, Danny Pine at NIH, Sonoff Mednick over at, back at USC, and a number of other individuals. Yeah, but that's indirect, okay? But that's the beginning. I'm focusing on early factors that shape the antisocial, aggressive, violent trajectory. Another issue will be lead exposure. So lead exposure prenatally has been linked to all the way down in development to later adult crime and violence. And you'll hear a lot more about this from Sarah Jaffe later in the conference. But just to note that there's a tight linkage in terms of secular trends between the amount of lead in the environment and the amount of violence in society across all different cities in the United States, and that's true in many countries also throughout the world. But again, Sarah Jaffe is going to talk more about that to you. Just one thing to note at this point, what does lead do to the brain? It's of course neurotoxic. What part of the brain seems to be most affected? This is work by Cecil, who brain scanned individuals who had high lead levels, followed them up into adolescence, and finding a reduction in thickness in the polar prefrontal cortex and the medial prefrontal cortex here. And that data is in males. I'll come back to Cecil towards the end of the talk as well. Okay, what else? Well, are we born bad? Are aggressive, violent individuals born bad? Not really. I mean, there's no destiny, is there, for violence and crime? Nobody's really born bad. But by this question, if you mean, does a bad birth give rise to antisocial and violent behavior? I think there's some truth to that. It's based on data that we collected, or that we published, I should say, way back, way back, 1994 here. This is a sample of 4,000 babies. On the y-axis, you have rates of violence in the offspring. The controls have neither birth complications nor maternal rejection in the first year of life. This group just has the maternal rejection. This group, just the birth complications. This group, the combination of birth complications and early maternal rejection. And it's that latter group that has a threefold increase in violent crime 18 years down the road. And that was conducted in Copenhagen, Denmark. It's a Caucasian sample. Picaro and Tibbets went and asked the question, well, does that replicate? Replication, of course, is an important issue, isn't it? And they did a study in Philadelphia, United States, all on African-American babies this time, and found the same effects. I'm really putting that up to try and illustrate something I'm not going to talk about too much, which is super important. Paul has alluded to it, the biosocial interaction. Many of us who are here today will talk about biological influences, but of course they interact with social factors in predisposing to later violence. Let's not forget that important issue here. Okay, what else? What else early in life raises the odds that that kid could grow up to become violent? I'd like to highlight the work of Patricia Brennan, my past postdoc student, did this wonderful work, I feel, not my work, it's her work, again, with 4,000 babies in Copenhagen, Denmark. On this graph, on the y-axis, you have rates of violent crime at age 34 in the offspring of pregnant mums who smoke to different degrees. On the left-hand side, these mums have 0 cigarettes in the 3rd trimester of pregnancy, and you can see the next group have 1 to 2, all the way up to more than a pack of cigarettes a day. And what you can see there from Patty's data is, a dose-response relationship. The more cigarettes the mum smokes, the higher the rates of violence in the offspring, way down the road to age 34. And that's controlling for loads of background social factors. She did a terrific job in controlling for background factors. That's not a one-off finding. It's been found in way more, actually, than 20 studies right now. The issue is it a direct effect of nicotine exposure on the fetus, the hypoxia that comes from the carbon monoxide, shutting off nutrition to the fetus and negatively impacting the developing fetal brain? That's one issue. Other people would argue, not really, it's a genetic confound. Mums who smoke cigarettes during pregnancy do not care for their growing baby, and they're passing on that antisocial tendency to their fetus. So it's still an open question whether there's a direct effect of nicotine exposure or whether it's a genetic confound. But what's true, better keep away from that speaker. What is true, though, from this work by Toro, again following up individuals who were exposed to smoking during pregnancy, there's a reduction, again, in functioning in the ventral region. Actually, this is thickness. Reduction in thickness in the ventral region of the prefrontal cortex. And I'll turn back to that area a little bit later. Okay, so what else? So that's smoking, and there's minor physical anomalies. Another thing, I love this study. It's on nutrition. Not my study. It's a study by Richard Neugebauer at Columbia University. Lovely study to my mind. It's set in Netherlands. And the story is, it's towards the end of World War II. German soldiers were pulling out of the Netherlands, and there's a food blockade on the country. And so, the kids in that country, the adults, were on, really low protein diets. You can see how skinny the kids were. And some mums were pregnant during that time. So in this amazing study, some of the mums were exposed to poor nutrition during pregnancy. And they are matched to mums in the same country who were not exposed to poor nutrition. And what Richard Neugebauer here found in this enormous sample of over 100,000 individuals followed up into adulthood to measure antisocial personality disorder is that if a mum has poor nutrition during pregnancy, her offspring are 2.5 times more likely to grow up to become antisocial personality disordered. I think you have a question, but I wonder if you could just hold the question until we come to the end. We should have 15 minutes for questions, and you, my dear sir, will be the first one on. Okay, so, poor nutrition is one of the factors. Poor nutrition is another factor. What else? Smoking during pregnancy. Drinking during pregnancy. Fetal alcohol syndrome, you've probably all heard of that. It's reflected in craniofacial abnormalities that you see in the fetus on the day it's born. I want to highlight this work by Streisger. Again, amazing study because fetal alcohol syndrome is a relatively rare disorder, but she has 473 babies who she follows up into adolescence. And these are the rates of delinquency, police contacts, and arrests in these teenage kids. And you can see that's pretty high, isn't it? Now, of course, one of the reasons for that is that mums who drink like a fish during pregnancy, right? They may not be the best mums in the world. They're suffering from alcoholism. That's going to impair their parenting skills. So that might be a reason why these kids grow up to become juvenile delinquents. But we also know that alcohol exposure is neurotoxic. You're nodding your head over there, aren't you? You know about this. So to illustrate that, this is the brain of a baby that died at 6 weeks of age for reasons other than fetal alcohol syndrome. And that's the brain of a baby that also died at 6 weeks of age, but due to fetal alcohol syndrome. And you can see the negative deleterious effects that alcohol exposure during pregnancy can have on the growing child. And, to me, it raises a sort of social moral question in a way, because we can look at this innocent little baby and ask ourselves some questions. Does this baby have fetal alcohol syndrome? Yes, you can see it in its face. Is this baby more likely to grow up to become a criminal offender? Nodding your head, yes it is. We've seen that from Streisger's data, haven't we? Is this baby responsible for the fact that its mum took alcohol during pregnancy? No, it's not. Will we hold this innocent baby responsible for its crimes in adulthood? Nodding your head, you're saying yes, yes we will. So my question to you, is that justice? Is that your concept of justice? Shaking your head, no it's not. It's not my concept of justice either, but we may differ on that. Because the problem is this, if you don't hold that baby responsible, then who is responsible for those crimes? Who would you say? Who? Society. What I was thinking about was, how about the mother? Why don't we blame the mother? Well, that is being done in some cases. Let me give you this example of Jamila Falls in Memphis, Tennessee. So Jamila, she gives birth to a lovely little girl on July the 5th, not born on the 4th of July, born on the day afterwards. Should be good news. The bad news, though, is that baby tests positive for heroin and marijuana on the day that it's born. So in Tennessee, that's an assault of the mother on the fetus. That's the legal term. It's the fetal assault law. And Jamila is convicted to imprisonment for 6 months for assaulting her fetus. So again, the question I have for you, which I can't answer, maybe you can, is, is that the way to go? Don't we need more parental responsibility to create better parenting to avoid situations like this? And doesn't the 6 to 9 month old fetus have rights? The rights not to be, quotes, abused in this way. That's one perspective. The other perspective is Jamila Falls needs help and not handcuffs. And maybe that's something that you can come back to me with later in our 15 minutes. Okay, so that's just another issue there. Now what I want to do is turn onto neural mechanisms that may underlie antisocial, violent, even psychopathic behavior. You'll hear a lot more from James Blair and other people on this. Ted's going to be talking, I think, will you be talking about brain imaging data? Good, Ted. Okay, you'll hear a lot more from those experts. I'll just skate the ice a little bit. I could fall through the ice here on a couple of issues. But let's just talk about, well, what parts of the brain may be potentially impaired, but possibly by the factors that I've just described, those early in-life origins of neural maldevelopment. Okay, so going way back in time, back in 1994, I did a study on murderers. I'm popping this up. It's an old study, but it's on murderers, which sort of fits this meeting, right? So, okay, so we had 41 murderers, 41 controls. This is brain scanning, positron emission tomography. You've got a bird's eye view of the brain here, front and back. And the key point from this study is that as a group, the 41 murderers had poorer functioning in the prefrontal cortex, which is at the top here, compared to the normal controls there. And I think many of you know that the prefrontal cortex, amongst other functions, is involved in emotion regulation. It's involved in impulse control. It's also involved in moral decision-making, which we'll circle back to a little bit later. A lot of caveats here. Not all murderers have poor frontal functioning. If you divide those murderers up into planned, regulated, controlled murderers versus murderers whose homicides were impulsive and very emotionally charged, what you find is that, if you look at the middle figure, it's the reactive, impulsive, violent offender, or murderer in this case, who has the poor frontal functioning. And the planned, regulated murderers, maybe as you expect, do not have the frontal impairments that their impulsive compatriots have, which sort of makes a little bit of neurological sense. Okay, so that's the starting point. One part of the brain, prefrontal cortex, and I think many of us sort of believe, yeah, that is one of the key areas linked to antisocial and violent behavior. Not the only area, but one of them. Okay, another area, the striatum. Striatum is a deep gray brain area, so it's deeper within the brain, more towards the midline. Roughly, this is its position in the brain. It's a complex structure, rather like the amygdala, made up of different nuclei here. We won't go into that, but just a couple of findings. My graduate student, Andrea Glenn, did this study in 2010, where she found that psychopathic individuals have a volume increase in the striatum, a 9% increase in the striatum compared to matched controls. I can't push this point too far, but you know when you have an impairment in the brain, well, there could be a lot of causes of that. It could be due to head injury, couldn't it? But what happens when you get an enlargement? I begin to think with an enlargement, that potentially is more neurodevelopmental, for example, or more likely to be neurodevelopmental. That's in terms of structure. Just within a couple of months of that study, Josh Buchholz at Harvard did a study showing that psychopathic individuals are more reward hypersensitive and showed more dopamine release from the striatum. So both in terms of structure and functioning, there seems to be some type of abnormality in the striatum. Ted Buchain here sitting right here, is going to be talking in a lot more detail today about dopamine, about the striatum, and he may have a different perspective. He's going to be talking more the child level. Just be careful, this is adulthood. And child-adult doesn't always connect. But the part of the brain that's critically involved in rewards seems to be, if you like, exaggerated in psychopaths. And if you think about psychopaths, these are individuals who are pathologically seeking rewards in their life. Why do they do that and break social barriers and norms to do that? Well, maybe they have a striatum, a reward system, which pushes them or nudges them towards chasing, maybe in an outrageous way, the rewards that they want in life. I can't push that perspective too much. It may be overly simplistic. But striatum, we're beginning to think more and more, and James has written extensively on the striatum too, and I'm assuming he will touch on that issue as well. But that's another brain area, prefrontal cortex, striatum, cavum septum pellucidum. So that's something you may not be familiar with. So let me describe it. I'm highlighting it because more than any other brain imaging finding in the field, this one more than others is much more likely to be neurodevelopmental in nature. First of all, what is it? Cavum septum pellucidum. You can all see that. Focus your attention. This is a coronal cut cutting this way through the brain. And focus your attention on what's inside the red box. Inside the red box, you've got two leaflets of gray and white matter, two thin leaflets which look like this. And in the middle of that, there's a black piece. That's a cavum, or space, a space between the two leaflets. During fetal development, the limbic regions around that area grow, and they compress those two leaflets so that they entirely fuse by the time you are 6 months old. So here's the fusion there. This is now 6 months post-birth, and you can see that those two leaflets have fused into one. Right, so most of us will be the figure on the left. Some of us have maldevelopment of the limbic, emotional region of the brain early on in life, even before we are born. And we'll look more like the right. We were able to find 19 adult males in society with cavum septum pellucidum. We compared them to normal individuals on scores on psychopathy, assaults, convictions. And if you look at this chart, the red bars are those with the neurodevelopmental abnormality, cavum septum pellucidum. The yellow bars are controls. The red bars, you see, have higher scores on antisocial personality disorder, PCL, psychopathy checklist. They have more arrests. They have more convictions. Okay, so it's a beginning. It's a suggestion that maybe, yes, a neurodevelopmental basis, at least to arrest, conviction, psychopathy, and antisocial personality. Does that replicate? Sort of yes and no. Broadly speaking, it tends to. The only studies I know of, I'll talk to you about. This is a study here by Stuart White and James Blair, again looking at cavum septum pellucidum, but this time in kids. So my study was adults, their study of kids, and what they found is that the kids with the neurodevelopmental abnormality, cavum septum pellucidum, they had higher psychopathy scores. I use the word psychopathy. I should say callous and emotional traits. They have more proactive aggression. They're more likely to have a diagnosis of disruptive behavior disorder. So I think it doesn't exactly match, but broadly speaking, it sort of is going in the same direction. The only other two studies I know of are these. Now, they were conducted by crooks. Crooks. So if you have a name like Crooks, what are you going to do in life? You're going to study crooks. You're going to study a lot of crooks. And she studied a whole bunch of them, 1,500 prisoners. She brain scanned those. This is Ken Keel's laboratory here in New Mexico. 1,400 of them. And what she found, and these are males, these are all males, she found that those with cavum septum pellucidum had higher psychopathy scores. Not more likely, though, to differ to normal control. So that's a null finding. But with psychopathy, at least, yes, there seems to be some signal there. Those are males. How about females? So she rounded up 355 female prisoners. She finds the same thing with respect to psychopathy. So this message of neurodevelopment especially seems to tie up with respect to more psychopathic forms of antisocial behavior. Let me just have a swig of water here. Let's see, how's time? Oh, not too bad. Okay, so you can't go anywhere in the world. I'm not talking about the amygdala, it seems, if you're doing brain imaging. Okay, so my other graduate student, Yang here, and it was really, honestly, her work, not mine. Amazing study that she did here, taking a bunch of psychopaths, adults, comparing them to controls here. And what she found is that compared to the controls, the psychopaths had an 18% volume reduction in the amygdala. But more interestingly, what she did, she broke down the amygdala, which is really 13 different nuclei. There's 13 brain structures within the amygdala, and a blue dot indicates a deformation in that specific part of the amygdala in psychopaths compared to normal controls. And so specifically, she found that it's the basolateral and lateral nucleus and the central nucleus of the amygdala that's especially abnormal or impaired, let's say, in psychopathic offenders. That's of interest to us in retrospect because those parts of the brain, especially basolateral and central nucleus of the amygdala, are involved in something called fear conditioning. I'm going to come onto that in a second. And the reason for that is this. The problem with brain imaging studies on adults is that inevitably they are correlational. So it's a chicken and egg question. What comes first? Is it the impaired amygdala? And the amygdala, I should have said, is centrally involved in emotion. It's centrally involved in emotion. And psychopaths, I think, as you know, lack emotion. They don't lack emotion, but their emotional feelings are, let's say, attenuated compared to ours. So what comes first? Is it impaired amygdala early on in life causes psychopathy? Or could it be living a psychopathic way of life results in amygdala shrinkage? We know that life experiences change the brain. So, at least to my knowledge, there's no longitudinal brain imaging research on 3-year-old kids measuring the amygdala and showing that those with impaired amygdalas go on to become adult offenders. But what we were able to do in this study in Mauritius, and this is the work of my other graduate student, what we were able to do in Mauritius, the study that Paul mentioned, is we measured fear conditioning in 3-year-old children. These are all kids in the community, unselected sample. So fear conditioning is a proxy for amygdala functioning. If you have poor fear conditioning, that indirectly reflects poor amygdala functioning. So that's measured in these kids. It's an autonomic measure. Then we follow up the kids for 20 years until the age 23. We find about 137 of them have a criminal offense. Those are matched 2-to-1 with controls, matched on 11 different indicators of social adversity. Right, now let's look back in time now to age 3, and let's look at the fear conditioning, which is on the y-axis, and the green bars are the tots who grow up to become criminals, blue bars are the matched controls. And what you can see is that, yes, the kids who grow up to become criminal offenders, they have poor fear conditioning at age 3. And if you think of poor fear conditioning as that proxy for poor amygdala functioning, that would suggest, albeit doesn't exactly prove, that the poor amygdala functioning is what comes first, predisposing to later psychopathy later on in life. Now, the effect size is not large, it's quite small, it's 0.35, so can't run away with implications of a finding like that. At the same time, when my graduate student published that in this journal, American Journal of Psychiatry, the journal ran an editorial on her article. So it's a critique written, in this case, by Philippe Sturzer, who says, born to be criminal, what do we make of that? What do we make of that? And Sturzer says, hey, we've got to be so ultra careful on this, because a study like this, if applied in society, could be used to stigmatize little kiddies. And that would be wrong. And sure, we'd all agree with that. But Sturzer goes on to say, but neurobiological research is giving us windows into the criminal mind. It's giving us a greater understanding. And Sturzer finishes his review by saying, so this should be used to benefit those kids at greatest risk to a criminal career and design interventions tailored to their needs. So my question to you is that the way that you want to see science applied? Do you think we're there yet? Or do you think we're way late in starting to do that? We really need to do a lot more screening and intervening early on in life, well before the damage is done, to help these kids. Two different perspectives there. So again, I'd be interested in your thoughts in discussion time. Still with the amygdala, I want to turn on to moral decision-making. So this is a study, it's a small-scale study that my graduate student did, giving moral dilemmas to individuals who vary in degree of psychopathy. It's the trolley dilemma. I think you're familiar with it. You're on a footbridge with a large gentleman. Runaway trolley is going to kill 5 railway workers. You know, what do? If you push him off the bridge, you've saved 5 people. You know, so what do? Do you do nothing? 5 people die you could have saved. Or do you push the big guy off the bridge? Okay, so what we know from that, we know that there's a neural circuit that underlies moral decision-making. And one part of the brain that's involved is that area we've talked about, the amygdala. So when we do these when we go through these moral dilemmas, when we make these moral decisions, we get activation of the amygdala. In part because when you're trying to work out whether to push the big guy off the bridge or not, it's sort of awkward, feels uncomfortable. I mean, in part, that's the emotional amygdala kicking in there. What Andrea, my grad student, did is every red dot is a person. On the y-axis, you have activation of the amygdala, and on the x-axis, you've got psychopathy score running on the left from low to high on the right. Small study, but she finds a correlation. The more psychopathic the individual is, the less the functioning of the amygdala when they make moral personal dilemmas. Okay, so that also may help us in some way understand why psychopaths do the very immoral things that they do, right? Because of this amygdala impairment. But again, to me, it raises a moral question in this way. We know that psychopaths, cognitively speaking, know right from wrong. There's no question about that. You know, I mean, Hannibal Lecter knows it's wrong to eat somebody's liver with fava beans with a nice Chianti. He knows it's wrong to do that. But does Hannibal Lecter have the feeling, the emotional feeling of what is right and wrong? And if we buy into Andrea's research findings, they don't have the emotional feeling. But isn't it the feeling, the emotional feeling of what is right and wrong, which drives moral behavior? Isn't it the emotional engine? You're nodding your head. You agree with me here. The emotional engine, that gives us that sense of moral, what's morally right, that leads us to do the morally right things. But, you know, what if your amygdala is broken, as it is in psychopaths? And, you know, where I'm coming to is, you know, psychopaths don't ask to be born with an amygdala that's 3 sizes too small. No, they don't. So if that's what's causing the psychopathic behavior, how moral is it of us, Mel, to punish psychopaths as harshly as we do? And you're shaking your head there, so it sounds like you maybe agree with me. Maybe we ought to take this into account, in part at least. Let's see. If you'll excuse me, I'm going to skip the neuromoral perspective here. If you want to get in touch with me, I'll send you a manuscript on it that's just come out. I want to move to preventive strategies because, you know, I'm talking about, you know, bad brain, bad behavior, broadly speaking. And if that's true, neurodevelopmentally, what do we do about it? That's a really difficult question, I think. And so we're struggling here, but we need to try and develop new treatment approaches to try and change things. And I'll just mention a couple of things here that at least I've been involved in, but there's more. One is omega-3. So this sounds very fishy, I know, but the whole idea is, will omega-3, is that like the magic bullet that's going to shoot down crime figures? I don't think it will, but this is a study that we did. So we gave omega-3 to kids in this study we're doing in Mauritius. Omega-3, as you know, is a long-chain fatty acid critical for brain structure and brain function here. Now, how do you do that? Well, you could give kids a whole load of fish, but you know, kids don't like a lot of fish. So what we did, we gave kids a fruit juice drink containing 1 gram of omega-3 each day. It's only 200 milliliters, like 2/3 the size of a Coca-Cola tin. But they scoff it every day, get a gram of omega-3 into their little bodies, and it's a randomized control trial. So 100 kids are randomized into that condition. The other kids have the placebo condition. They get the fruit juice drink, but it doesn't contain omega-3. Okay, then the parents rate their kids' antisocial behavior at baseline, 0 months. 6 months, that's the end of treatment. And then 12 months is 6 months after the treatment. And 2 things happen here. First, a placebo effect. Both groups drop at 6 months. Placebo effect. We know about that from medicine. But when the treatment stops, the controls, the red line, go back to where they came from, whereas the omega-3 group continue to decline. So, could it be that omega-3 might be something to upregulate the brain, to upregulate behavior? That's just one of 6 randomized controlled trials I've been doing specifically on omega-3 with respect to antisocial behavior. Haven't got the time to talk about them all. Most of them are on kids. One of them are on young offenders in prison. But you can talk to me in discussion time about that if you want to go a bit further. Okay, so you may say, okay, yeah, give kids fish oil, that's okay. You know, nobody will disagree too much with giving better nutrition to kids. But how about stimulating their brains directly using transcranial direct current stimulation? Well, that's something that my graduate student did. It's on adults, not kids. But what she's doing here is it's a randomized controlled trial where 40 individuals have the prefrontal cortex stimulated. The other control group think they're getting the stimulation, but they're not. And then what she does, she brings them back and gives them social vignettes, like scenarios about if you were in this situation, would you perpetrate a violent act? For example of a physical vignette, you're in a bar with your girlfriend, you go to the restroom, come back, and some other guy is hitting on your girlfriend. And worst of all, she seems to be enjoying herself. So, you know, you come up to him and say, hey, that's my girlfriend. And he said, no, she's not. She's not wearing a ring. She can speak to anyone she wants. So push comes to shove. The scenario gets more intense. Question, would you pick up a beer bottle and whack this tyrant on the head with it? And what Olivia finds is that if you have the prefrontal upregulation, that reduces your intention to commit a violent criminal act. It's true for physical assault, it's true for sexual assault there too. Important caveat, she measured aggressive behavior in the laboratory, but she does not find that prefrontal stimulation reduces aggression in the laboratory. In this case, it's only reducing the intention to commit a violent act. On the other hand, what comes first, the intention to commit a violent act or the actual behavior? Maybe this is a stepping stone which, if we can knock out, it may reduce violent behavior. Needs replication, needs extension. We're doing a replication study now, no findings as yet. Should also say that Olivia also found that prefrontal upregulation in this study enhanced somebody's sense of how morally wrongful it would be to whack the guy on the head with the beer bottle. And she found that moral upregulation from TDCS accounted for 1/3 of the treatment effect. It was a mediator. It mediated the relationship between prefrontal upregulation and reduced criminal intent. Again, very beginning, you know, this is down the road about where we can go with that. Lastly, in the last couple of few minutes, I want to turn to Paul's question of why males? Why males here? Okay, Paul, well, this is a tricky question, as you know. I think other people, I think Ted's going to have a lot nicer data to talk about there. Why males? One thing I want to do is go back to that data by Cecil, which, you know, if you're looking at here, at the scan again, you can see the frontal impairment from lead exposure. So these are males with lead exposure early on in life, and we're looking at their brain functioning at age 21 here, age 21. Okay, so there you see, lead exposure is not good for male brains. But what I haven't shown you are the females. The females who were just as much lead exposure, what happens to their brains? Nothing. No effect. So I know what you're thinking. You think, oh, okay, so the boys are running around a lot more than the girls. They're more hyperactive, attention deficit disordered, sticking their fingers in their mouth with the dirt on, absorbing the lead. The little girls are not. They're not doing that. Not the case, because these are the lead levels at age 3 of the males and the females, and they are identical. So what it brings back is the whole concept of the vulnerable male brain, that in some way, for whatever reason, male brains are simply more vulnerable to teratogens like lead exposure. Why that is goes beyond my expertise. But that's sort of one thing I'd throw in here, Paul. Another thing I'd throw in is heart rate. Of all the crazy things, low heart rate as a reason why boys commit more crime, aggression, and antisocial behavior than girls. And we can talk about why heart rate in question time, but empirically, this is the data. Again, it's that Troy woman again. Sex at age 0, at least I think it occurs around that time or a few months before, and she's got crime at age 23. And yes, there's a relationship, there's a link. Males commit more crime, strong effect. But she has heart rate at age 11, and males have lower heart rates at age 11. Low heart rate at age 11 is associated with more violent crime at age 23. And heart rate partly mediates that relationship. So it's partly explaining the reason why males are more violent. Why? Because males have low heart rates than women. And that's a very well replicated sex difference in heart rates. So I would throw that in, Paul, as possibly one, I'm scrambling here, as you can see, one reason why it is, biologically speaking, that males are more aggressive, violent than females. And just lastly, I'm going to be ending here. That just replicates that finding in callous and emotional kids. Okay, you get the same thing in terms of explaining the gender difference in callous and emotional behavior. But just the last thing, also sex differences in the brain. So we've talked about that ventral underneath part of the prefrontal cortex here. So this is a study in which I found impairments to 2 sectors of the prefrontal cortex in relation to antisocial personality. It's the middle frontal gyrus and the orbitofrontal gyrus here. So in males, if you look at the orbitofrontal and middle frontal gyrus, lower volumes in those areas were associated with higher scores on antisocial personality and a self-report measure of crime. We had a small female sample, and that was true in the females. So in the females, just the same thing. Brain impairment there, or reduced volume there, and higher antisocial behavior. Okay. What we also found, though, is gender differences in the brain here. And other people have found this too. We find that males have a reduction in volume compared to the females in orbitofrontal and the middle frontal gyrus, not the other 2 gyri. We also found sex differences in antisocial behavior, which, of course, everyone finds. But the key point is this. In looking at the sex difference in antisocial behavior, if you control for the gender difference in gray matter in these 2 sectors of the prefrontal cortex, you reduce the sex difference by about 51%. So what we're trying to say, again, small-scale study, got to be careful, but what we're talking about is fundamental sex differences in the brain, partly accounting for the fundamental sex difference in crime and antisocial behavior. Right, just to wrap up here, I've been talking about the neurodevelopmental perspective. Can that make a difference? To us, if we reconceptualize chronic violence as a neurodevelopmental disorder, would it change things in society? Would we get more funding for the research that we, us guys, would like? And for many of you, would it give more funding for early intervention and prevention? Early influences on development, I've talked about minor physical anomalies, birth complications, poor nutrition, smoking exposure during pregnancy, alcohol exposure, and the question of where do we go with the question of who's responsible here? Neural mechanisms, prefrontal cortex, striatum, cavum, septum pellucidum, actually the list goes on, almost endless. I'd love to get back to the neuromoral perspective. Sorry I had to miss it out. Prevention, just got to start on new treatments here. Biological interventions. We've avoided systematically biological interventions for violence. And I think that's wrong. We need to get back there. Biopsychosocial interventions may have better traction in the future. And why males? Well, I've talked briefly about the vulnerable male brain as just a concept. I've talked about low heart rate as one reason why males are more violent, and also those sex differences in the prefrontal cortex. Paul, I think we've got some time now for questions. And dear sir, I think you are first off the mark. If you can come up to the microphone.
Yeah, just curiosity. In the report that you gave of the study that was done on famine in
The Dutch famine study.
Was it in Denmark or the Netherlands, you said?
That was in the Netherlands.
In the Netherlands.
That was
okay.
Richard Neugebauer, Columbia.
There must have been other dependent variables other than antisocial personality disorder, and I was wondering if you know what other outcomes they looked at. Because I could imagine a whole host of them.
I actually do know what they've looked at, yes. One of them is schizoid personality disorder, or schizoid personality. So they also find that kids who have this poor nutrition also grow up to be more, quote, schizoid. So schizoid is a bit distant, a bit aloof, a little bit on the shy side, emotional blunting. So there are common denominators here. And I think your question is an important one, because almost everything I've talked about today as risk factors for violence and crime are also risk factors for other psychopathologies. The only exception to that is low resting heart rate. In terms of clinical pathology, no other clinical disorder at all is characterized by low resting heart rate. That is diagnostically specific. Nothing else I've talked about is. And that leads to a bit of a quandary, doesn't it, about, why is it that some kids turn out in that study to have antisocial personality disorder, and the same risk factor, poor nutrition, is coding for schizoid personality disorder? I think a very important question. I have not addressed that issue, and I think it should be addressed. Anyone else? Oh, yes, if you could come up to the microphone, please, so that everyone can hear you.
My question is from a perspective of a psychiatrist, and what I've seen in the prison population that I've worked with, a large amount of people with bipolar disorder. Can you comment on any studies that have been done on bipolar disorder and violence?
No. I'm sorry, it's beyond my expertise. But maybe another speaker later today could circle back to that question. I'm very sorry. I know beans about bipolar. Yes, sir.
Recently, there's a lot of information about epigenetic factors.
Something else I know nothing about, epigenetics. Go on.
Okay, now, well, you see, you've given a wonderful explication of we might say the hard data, but we've been discovering that depression in particular, or the health of the mother and the father are epigenetic factors. And I was wondering how that epigenetic component could be calculated and factored into some of your work.
Yeah, I'm sure that epigenetic processes, thank you for your question, I'm sure that epigenetic processes are involved here. Again, I feel like such a dummy, but I don't do the work on epigenetics, and I also, worst of all, don't know the literature on epigenetics and these risk factors. I'm getting really desperate as a speaker here. Do any other speaker here, can I take up the gauntlet and cover my base here on that really important and good question? I'm sure that it's going to be the case, but I just don't know. I just don't know specifically what epigenetic processes are coding for which of the factors I've discussed in relation to the behaviors I've talked about. However, the silver lining to the cloud, I'm the cloud, the silver lining is that Richard Tremblay is also going to be a speaker here at the conference, and he's going to be addressing epigenetic factors. So if you're going to raise your question with Richard Tremblay, that would be great. And coming back to bipolar disorder, yes, there's a lot of comorbidity in prisons, aren't there, with many other different disorders. And so possibly, at the end, I began to talk about treatment approaches specifically with aggression, but maybe you raised the question on bipolar because maybe your idea is, well, if we can treat the comorbid conditions, maybe that will do something in great part to alleviate the aggressive behaviors that patients like bipolars do show. And I think that's the case. On that point, I think the only one thing I would say is that we have developed medications for schizophrenia, attention deficit, many other clinical conditions. One thing we've never tried to do, ever, is develop a medication for aggression. And that's despite the fact that some medications, by complete chance, work really well with aggression, like atypical antipsychotics, like risperidone. So, two things. Yeah, attacking the comorbid conditions, that can be important. Number two, biologically, can we do something more in terms of developing medications for reducing aggression? I know that's out of left field, that suggestion, but I have wondered about it. Thank you. Neuromoral perspective. I was waiting for that question. I find this interesting, not really because of the work I did, but the work somebody else has just done. Let me take that back here. Yes, so if you develop a theory, you're always proud of it, aren't you? So in 2006, I did this, call it neuromoral theory of antisocial behavior, which probably nobody else agrees with in the world. And I've just updated it here. But basically, the theory is something like this. If you look at the brain imaging work that's done on antisocial behavior, and if you look at the brain areas activated when people make moral decisions, you see an overlap. You see an overlap between those structures. So in yellow, those structures, like the ventral prefrontal cortex, anterior cingulate, polar frontal cortex, they are involved, or they are impaired in offenders, and they're also part of the neural circuit that underlies moral decision-making. So I was trying to argue that the disparate brain areas that have popped up in relation to antisocial behavior all fit on to a circuit that underlies moral behavior. So that the reason why people are antisocial violent is because of impairments to the neuromoral circuitry. Well, that's not all that interesting. But what I thought is this study by Darby. Really fascinating study here. So Darby. So what Darby has, neurologists, they've got 17 individuals who, after a lesion has occurred in their brain, they develop criminal behavior. In all 17 cases, the criminal and violent behavior, and it's predominantly violent behavior, occurred after the lesion. Okay, so you look at that. Where is the lesion? It's all over the damn place. You know, it's not in one specific location. But what Darby finds is that in all 17 cases, all those lesions are functionally connected to these structures: orbitofrontal cortex, ventromedial prefrontal, medial prefrontal, so a lot prefrontal, also anterior temporal, and also nucleus accumbens, which was a bit of a surprise. So the thesis of their paper is that, at least from a lesion perspective, that the brain areas which, when impaired, lead to crime are all involved in moral decision-making. So quite a different perspective from just the plain old brain imaging research that I base that perspective on, but some sort of converging support for that perspective that although the brain impairments are occurring all over the brain, nevertheless there is a common denominator to all of them, that they're all implicated in moral decision-making. A bit like, I don't know if any of you are old enough to have a Christmas tree where if one of the lights popped, all the lights will go out. Well, that's what Darby's suggesting here. You just have to pop one of the lights and you'll knock out the moral circuit. Yeah, wow, that's what I thought too
Go ahead.
when I read that paper. Yes?
I have a question about a number of the studies that you've talked about this morning rely on psychopathy and antisocial personality disorder.
Yeah.
And so I'm curious about the construct of psychopathy, given that there's been a fair amount of research challenging the PCLR, which is often what's used to determine that someone is a psychopath. So I'm curious about that, given problems with the PCLR, and also with antisocial. In the DSM-5, the personality disorder work group put out a huge paper saying that the personality disorders are built on shifting sand and that they are challenging the construct of personality disorders.
Yeah,
So that's my question.
Yeah, good. So two questions there. The latter point is all about, do we have 5 minutes to go? Do we have a category, antisocial personality or not? And of course, many of us think, no, these are on dimensions. So yes, many of the things we talk about, even as neurodevelopmental disorders, are in some ways dimensions. So yes, it's a problem, and maybe there will be a future revision of DSM where we will go more dimensional. The first point you talked about is the psychopathy checklist is under siege. Yes, there are many other people who are developing different measures. Cook over in the United Kingdom developed an alternative measure to measure psychopathy. Other researchers developing self-report measures of psychopathy. Yes, it's important to have different measures of psychopathy coming in, but I don't think that the psychopathy checklist is a bad measure of psychopathy, especially in prison populations. I actually think it's a really good measure of psychopathy in prison populations. So people could disagree with me, but I think the excellent research on psychopathy using the PCLR is pretty good. Not to say the research can't be improved, but there you go. With 3 minutes left, we should turn to the next question.
I wondered, I'm interested in your study about the 3-year-olds, and I wondered particularly how you took into account the likelihood that at 3 years old, a good portion of those children may have experienced severe trauma within their families, and the small result.
Yes, very good point. Specifically at that time, at age 3, trauma, specifically trauma, depending on what you define as trauma, wasn't assessed. What were assessed were 11 different indicators of social adversity or adverse childhood experiences. But depending what you mean by trauma, one example, our 11 indicators did not include physical and sexual child abuse, specifically, and significant child abuse, in the way that people like Terry Moffat, Avsham Caspi have defined in their Dunedin study. So yes, that could be a factor. Question is, what do you want to suggest there? I mean, do you think that the results aren't really there because we didn't control for abuse?
Well, that was my question, yes.
Right, I'm trying to think of how abuse, I think the question would be, given that we're talking about fear conditioning and the amygdala, how abuse would affect that. Would abuse attenuate fear conditioning? Would it enhance fear conditioning? I actually don't know the answer to that question. And I think for the findings to be a confound, we'd have to have abuse in that criminal group, well, the group who grew up to become criminals. We'd have to have the abuse to be attenuating fear conditioning, the abuse to be impairing the amygdala. actually, yeah, I mean, there is research, even on structural imaging, showing that kids, even with low SES, with different forms of adversity, have a reduction in volume of the amygdala. Block you on the name of that person, but Hansen or Hanley. So actually, you've got a fair point. You've got a fair point. Those findings can be questionable because we don't have a good handle on especially significant trauma. We've got a handle on the other measures of adversity. Wrap up. Well, thank you very much, everyone, for your attention. Oh, thank you, Paul.
So there's a break now, about 15 or 20 minutes is in the schedule. No, I didn't.